Hi everyone, how are you doing? Hope you're enjoying the end of your summer holidays. I'm Nikki, and we have the lovely Rebecca Sartain with us today, and she works at Greyfriars Rehabilitation Centre. She is going to talk to us about hydrotherapy. And she has a lovely presentation. But before we go on to do this, I've been sharing this each time we've been doing a live this month, and I'm going to do it again just so everyone is aware of what's happening. So if you haven't heard, you should have done by now, but tomorrow is the start of our big walk. Now, this is a virtual walk. It's something that Cam likes to do every year, and ideally we do it in person, and everybody does their own walks and raises money for Cam. But this year, due to still having the COVID restrictions, we're going to be doing this virtual big walk. So if you haven't got involved, please do check out the information on the website or on the CAM Facebook page. It's all there. Lots to learn, lots to see. There's going to be live Q&A sessions on the Big Walk Facebook page. To get involved with that, you can come with any of your questions that you like there. We've got some big names coming to do that. We've got Mike Shikashio, we've got Gwen Covey, we've got Matt Brunke, we've got Gemma Hodson. So please do join us and get involved with this. It's really important that we keep CAM going and keep helping people like yourselves. So I'm going to take this off now, and we're back to Rebecca and myself. So before I share your presentation, Rebecca, would you like to just give us a little rundown about why you're so great? And Rebecca said you have such big names coming on CAM, and I'm just really happy to be here. I was like, but you're a big name to us as well. So welcome. Thank you so much for joining us. And please give us a little bio about yourself.
Awesome. Thank you very much. And thank you very much for having me. So my name is Rebecca. I'm a registered canine hydrotherapist, and I've been working within the hydrotherapy industry for the last 7 years now. And hydrotherapy is just such a fantastic topic to talk about. So I'm really excited to share the presentation that we have today. And also in terms of arthritis, it's a really important condition to me, both personally and professionally, because my own dog, Max, who's a beautiful 8-year-old Siberian Husky, has had arthritis since the age of around 2 years old, and various orthopedic conditions alongside. So I'm forever trying to learn more about arthritis and different managements we can be doing, which obviously works alongside helping our arthritic patients at the Hydro Centre as well.
That's great. Thank you. Right, are you happy for me to start sharing your presentation?
And yeah, feel free.
Have you got any pictures of your dog today? Any videos?
He does make a sneak appearance, so I shall show. Indeed, I'll point him out.
Excellent. If you have any questions as we go along, please do, as normal, jot them down, and I will try and fit them into Rebecca as they come up, really. But yeah, let's get started.
Perfect. Awesome. So I thought that this would be a fantastic opportunity to give you as CAM followers and dog owners the chance to see, from a hydrotherapist perspective, what we're looking for when we're doing a hydrotherapy treatment. So I've got some fantastic underwater footage to show you, and just want to give you a brief overview of the sort of things that we're looking out for when we are doing a hydrotherapy session. So before we get into the treatment side of hydro, there's just a couple of key points that we need to consider prior to hydrotherapy. So the first point to consider is if your dog is suitable for hydrotherapy, because there are a few cautions and contraindications that may be apparent, which means that your dog may not be suitable for hydrotherapy either in the short term, i.e. due to an infection, for example, or an open wound, or it could be a long-term caution that we need to be aware of, such as a low-grade heart murmur, for example, where we just need to ensure we're aware of the caution in place, so that we can provide safe hydrotherapy treatment. So once we believe that your dog is suitable for hydrotherapy, the best way to be looking for a hydrotherapy centre near you is by looking at a registered hydrotherapy centre. And this is basically where hydrotherapists are members of particular professional associations. So there's a list on the screen there. So we have the option of NARC, CHA, IRVAP, and often there'll be members of multiple associations as well. And it just means that if they're a registered hydrotherapists and have a registered hydrotherapy centre, you know that they're going to be working to a set standards. Another important consideration is that your dog has a referral from your veterinary practice as well. And this is because we need permission from your vet as a hydrotherapist to do treatment on your dog. And this means that the vet gets some input into the hydrotherapy session. It means that they've signed a form that says they believe that that your dog is suitable for hydrotherapy. And they'll also in that give us full medical history, which again is really important because you may be treating a dog for arthritis, for example, but there may be other conditions that we need to be aware of and which can change the way that we're going to treat your dog.
Yeah.
So going a little bit into detail about registered hydrotherapy centres, again, it's really important that we know that you're receiving hydrotherapy that's safe and effective. And so as a member of NARC, for example, this is my professional association that I'm a member of. It means that I'm working to the highest professional standards and ethics, which are laid out by NARC. And NARC also maintains the list of registered canine hydrotherapists in the UK, which is really helpful for owners to go onto their website, for example, and they can search the hydrotherapist by name, by centre, or by location. So that's a way that you can find a registered hydrotherapy centre. And again, obviously, you have your other associations as well. NARC regularly audits the hydrotherapists and centres as well. So it gives you peace of mind, essentially, that the strict standards are being adhered to. And NARC also promotes hydrotherapists to basically we should be continuing our knowledge and furthering our education essentially in this field and in adjacent fields. So we should be doing an annual hourly amount of continued professional development. So NARC has a website for owners and veterinary professionals that you can check out below, and that gives you more information about hydrotherapy and different members, etc.
It's really important, actually, isn't it? Because there is no rule. Anybody can theoretically set up a hydrotherapy centre, can't they?
Exactly. Yes. Unfortunately it's unregulated in that way. So that's why there's these professional organisations that do exist that you are a member of. And it just means that you're more confident in your choices of hydrotherapists and a hydrotherapy centre as well.
Yeah,
for sure.
Yeah. There's just a quick question here from Cassie. Actually, it just says, why does the vet have a say so? They shouldn't. If anything, the owner needs to seek this. If an owner says yes and the vet says no, then what happens? And I think, I don't know what you think about that, Rebecca, but what I would say is that the vet, it's a conversation you should have with your vet. The vet, it's not like they are acting and saying, you definitely can't have this. But if you want to get everyone, we were talking about this before we came live, that, we all have your dog's interest at heart. And if we can all work together as a team, then unless there is a very obvious and very good reason to not do the hydrotherapy, then I don't think a vet is ever going to say, no anyway. But it might be that they want to speak to the hydrotherapist and just share their concerns or share histories. But yeah, what would you say about that, Rebecca?
No, definitely. And I think it's all about the relationship, isn't it? We work really hard with the veterinary centres surrounding us, specialists in general practice as well. And they do have an important say within the hydrotherapy treatment because we're specialists in hydrotherapy. And so we've got our field of interest and knowledge, and vets have their own very important and very well needed area of expertise as well. So we need to be working together. And this applies, so we call it working with a multidisciplinary team. So we're not just looking at doing standalone treatment most of the time, especially with arthritis, because we know it needs a multi-modal approach. We need to be working with the vets because they're your go-to as owners. They're your go-to to, if your dog is painful, then you're going to the vets to ensure they're on the correct pain relief. So that they definitely have a very important role. But also it's about, again, like I was saying, so vets have their expertise. And if hydrotherapy isn't within that realm, then it's our duty as hydrotherapists to be calling the vets, to be explaining to them whether we think hydrotherapy is beneficial for this particular patient. And quite often it's the vets that send direct referrals to us because they see that they've got a dog that they think will be good for hydrotherapy or rehabilitation. So quite often, it's definitely a working relationship. relationship. And if it's a relationship that you feel is under strain, for example, you've always got the option of going to another, either different practice or a different vet within that practice that you're going to build a good relationship for, because we need everyone to have good relationships to be managing these dogs correctly.
I mean, I rarely I discuss hydrotherapy as quite a regular thing, really, in the pain clinics and the arthritis clinics. And there are some dogs that I feel the hydrotherapy would be really beneficial for, but I don't always think it's a good idea right now, because I want to get some of that pain under control before we then go for the hydrotherapy. So it's just about chatting between you as the owner, you as the hydrotherapist, and me as the vet, really, isn't it? Just a
definitely. And it's just about, and we may have a difference of opinion. So it's about working out the reason that the vet would prefer us to be doing a particular type of treatment, i.e. in the pool as opposed to the treadmill. And if we have a different opinion on the matter, then it's just a case of, by the time we've kind of discussed it and laid out all the facts, we're in agreement by the end of the conversation one way or another. So
absolutely. I hope that answers the question anyway.
Indeed. Thank you. Awesome. So the next slide is about the benefits of hydrotherapy, in particular for dogs with arthritis. And this could be a whole new presentation in itself. So I'll try and just keep to the highlights, essentially. But with arthritic patients, we know that arthritis is an inflammatory disease. So one of the benefits of being in water is that it helps reduce inflammation. And that's due to something called hydrostatic pressure, which means that there's pressure exerted on the object or your dog, a patient, and it has anti-inflammatory effects. And it also has effects such as decreased pain perception as well. So we've got the properties of the water that are going to have a host of benefits, and including the temperature as well. And then we also have what the therapist can add to the hydrotherapy and to the water, essentially, to make the treatment session as therapeutic as possible. So we've got reduced inflammation and pain, reduced weight bearing, which is such a fantastic option to have available to us, because we know that again, if you are in the middle of a flare, for example, with arthritis, is that it can be quite painful just loading your joints. So just being able to either have reduced weight bearing when standing in water, or being completely non-weight bearing and floating, has such a positive effect, not just to their joints, but also to their muscles and also to their general well-being. So yeah, buoyancy is absolutely fantastic and really comes into its own for therapeutic benefit. And again, that leads on to our next point, which is that it helps relax tense muscles. So again, arthritis isn't just a joint. It doesn't just affect the joint, it affects the whole body. And you can find when the dog's walking abnormally because they are uncomfortable, you're going to get tense areas in the body, on the muscles or the fascia as well. So the hydrotherapy can definitely help with relaxing muscles. Can also help increase range of movement. Hopefully you'll see why in future slides. Can also facilitate improved posture. When we're talking about posture, this is about any kind of static patterns, such as if a dog's standing, sitting, lying down, etc. So even just standing in water where we've got reduced weight bearing may mean that their standing tolerance is better because they've got the benefits of the water. You've got transitions, so that's transitions between static postures such as sit to stand to down, etc. And then we also have gait, which is movement. So it can, and that's where water treadmill in particular can be really helpful, but also using the hydrotherapy pool can also be so. We know that hydrotherapy is really good for promoting weight loss and supporting weight loss programs, and we know the importance of maintaining a healthy body weight for arthritis, because obviously with increased weight means there's more pressure through joints, and fat is also pro-inflammatory. So we need to be keeping everything as nice and lean as we can. Hydrotherapy also does a fantastic thing, which is it can release endorphins, which works really well in terms of pain relief, because we know that endorphins do have a pain relieving effect. However, it is something we need to be telling owners about after their session in particular, because they could have a really therapeutic float, for example, or they could be doing some really nice swimming. They could exit the pool and then feel really excited afterwards because of these endorphins. So we do need to make sure after doing a nice therapeutic move, exactly, that they're not going to do zoomies around the garden when they get home, because it's going to undo everything we've just done. So yeah, that's really so it's good, but we also need to be aware of it. builds cardiovascular fitness due to the resistance and turbulence of the water, and overall just improves quality of life, regardless of, there's so many different things, aspects to hydrotherapy. And yeah, if it's anything from a float or to actually doing quite an intense amount of swimming or walking, etc., it does have a really good positive effect on their quality of life, which is what we're all here for.
Yeah.
Okay, so moving on to how we kind of do our sessions. So at our hydrotherapy, we do ask our patients to see a veterinary physiotherapist, and this is something that we offer on site. So we have APAT registered physios, or we could have a physio which yourselves are already using, and then we can get the report from them, and then we can make a program between us. With our physiotherapists, they're almost like the gatekeepers to the hydrotherapy pool. So it's really a complementary therapy between each other, essentially, because it ensures that our patients, prior to starting hydrotherapy, have a comprehensive baseline assessment prior to the session. And this is where we can assess their strength, mobility, comfort levels, because our physiotherapists might do an assessment and may find that your dog, for example, is too painful to start dynamic hydrotherapy sessions. So we need to go back to the vet, get some additional pain relief on board, or make lifestyle changes, which mean we're going to have less pain there, to then promote hydrotherapy where we can be doing more dynamic work, etc. So it's just about, basically we have a baseline assessment as well, because the important thing about hydrotherapy is knowing that it's actually making a difference. We don't just want to be doing a hydrotherapy treatment week by week and then not actually achieving anything. So having this assessment on land and us seeing the improvements in the water works really well together. So that's why we do it beforehand. Yeah, indeed. So going into a hydrotherapy session with us, so what we're going to be doing beforehand is getting as much information from you owners as much as we can, because we need to be getting feedback from you since the last session. So how they were afterwards, how tired they were after the session, because this is going to be really important on finding out how we should be progressing their program, essentially. And if it's their first time attending, then we'll have a few more questions to ask, and there's a whole familiarization process that we'll be going through. And again, I have some brilliant video to show in subsequent slides. So once we have all of this information from you, we're then objectively monitoring our patient. So from the moment we see your dog leave your car to the point that they're coming up to our clinic room, we're going to be watching how your dog is moving. So with gait analysis, we want to be seeing how, if they're walking up, trotting up, and how easy it is for them. Postural assessments. So again, that posture is any static, standing, for example, what their standing tolerance is like. And also checking reflexes, which we do all the time with neurological patients, but it's also important to do reflexes on our geriatric patients as well, because just because a dog has arthritis doesn't mean we're not going to develop other conditions further down the line. And obviously being an older dog as well, we just want to ensure that we're aware of any changes, especially neurologically, because we'd rather pick up those things sooner rather than later. Yeah.
And I don't know, there's a couple of questions coming in about, and I'm not sure if you're going to cover this later, but I'll just say a little bit about it now. But there's a couple of questions about dogs that don't like the water, but I think you've kind of already covered what you've just said there. It's not just about the time in the water. It's the time from when you leave your car to when you're coming in, to when you're potentially going in the water, when you're coming out of the water. And when you talk about doing hydrotherapy, it's not, I think you're going to show this quite clearly anyway, but it's not just about spending an hour in the water, is it? It's about so much more.
Exactly. It is very much so. And I have got a really nice familiarization video that I can show you next, actually. So it is coming up, and it is definitely a really important topic to cover, because we don't expect your dogs to be walking into the pool and being happy that they're in the hydrotherapy pool necessarily, especially if they're not used to water. So it's not just about the physical element of your dog, it's also about the mental and emotional as well. And we really need to take that into consideration. For sure. So if, in case you're wondering, this handsome husky in the corner is indeed my one. So this is Max, and he does do the water treadmill. So this is him looking rather handsome, posing for a picture. Anyway, I digress. So treatment. So as soon as we've got the subjective and objective information that we need, we're then going to, and prior to your appointment, actually, we've already made a decision based on medical history, physio review, whether we think pool or treadmill is going to be more appropriate for your dog. And again, this doesn't mean that just because we're initially thinking this is the case, doesn't mean we can't by the end of the session be moving to the other piece of equipment if we feel like that's better suited for the dog. Because just because they're reading like something on paper with medical history doesn't mean that's what they're presenting like then and there, essentially. And dogs are going to vary from session to session. So we could have a dog where they feel very comfortable for the first few sessions, and then if they're in the middle of a flare, for example, we might find the different piece of equipment is going to be better for them, because so it's very much individual patient and their needs, goals, overall requirements, etc., which again we'll go through a bit about anyway. And obviously it is important to know, so we do have the option of using a hydrotherapy pool or a water treadmill. Some practices will have both, some practices will have one or the other, and you can still achieve really fantastic quality hydrotherapy in either piece of equipment. It's just when we have the option of both, like in our case, it means that we get to make those changes and we can do whatever we think best suits the patient. So excuse me.
Because at some centres you don't have that option, do you? It is one or the other, and that's fine. It's just using what you have. But if you have the choice, then great. Yeah. Exactly.
And active treatment isn't just going to include walking or swimming. It can also include static rehabilitation exercises, massage, which can be achieved in both.
Yeah,
for sure.
Yeah.
Familiarisation. It's like, I guess, the question. Okay, so this is a beautiful Roxy that's actually just started hydrotherapy with us. And beforehand, owners did have a few concerns because she is a little bit cautious about new environments, about slippery surfaces, about ramps, etc. So we knew beforehand that we're really going to have to take the time. And it's really important to take your time with these patients as well, because if you try and rush this process, it's definitely going to push you back, and you're definitely not going to achieve what you're looking for. So this is just a little bit of familiarisation that we was doing with Roxy ahead of time.
So no water in there.
No, exactly. So what we're wanting to do is her to make her own choice on entering the treadmill. And you can see that she's got motivation. She's got mum and chicken. But we just want her to realise it's a very safe piece of equipment, basically, and that nothing scary is happening. We don't want to be closing doors really loudly, etc. We just want her to know, and as well, especially in the treadmill, our overall goal is to get her walking in the treadmill. So we just want her to get the idea of, oh, okay, I come to the water treadmill, I'm going to do some walking, and and then when we start to add the water, for example, it's going to be a bit less spooky because she already knows what's kind of going on.
Yeah.
But you can see that she's very happy going in there, and by the end she was actually taking herself in instead of following mum through as well. So so it's really about breaking everything down and not going past their behavioural capabilities, essentially, because we're going to have some dogs that are really nervous. So in their first session or even their first couple, we may not even add water to the belt, to the treadmill, because there's no point moving on before they're comfortable with your first stage. So our first stage is walking through. The next stage is closing the doors and then standing there, getting treats, getting motivation. Only then, when they're happy with that, we can then start to add water. Only when they're happy to do slight little movements up and down on a static belt can we think about moving the treadmill belt. Because if they're not going to walk, if they're going to go statue-like in the treadmill, just standing in water, if we start the treadmill belt, it's just going to make them a bit more anxious. So, and that's something that we don't want to be doing.
Make the pain worse as well.
Exactly.
Yeah.
Another important thing to think about familiarisation is obviously as well, is it's all very well and good us doing lots of walking through the treadmill work, but we may have some dogs that are only capable of walking a few strides. So familiarisation is going to have to be potentially adapted depending on what the dog's physical capabilities are. Because if we've got an arthritic dog that, really struggles to walk 10 meters, then we're not going to get them walking through the treadmill for 25 minutes and exhaust them by the time that the water's coming up. So again, it's very patient specific. So this is a video of how Roxy got on her first session. Whoop. So she's still very much needing the chicken, which is absolutely fine. Positive reinforcement at its finest. So she wants to turn around, which is good. And then we start the treadmill. And again, so in the treadmill in particular, we're always looking for good quality movement. But on the first session, what we're trying to do is, like I said, familiarisation, and we're not expecting the perfect movement. You know, we've got dogs that have an underlying pathology. We have a reason for dysfunctional movement. So we're not expecting perfection initially, but the fact that on the first session, Roxy is happy for us to be doing certain holds and actually happy for some input is absolutely incredible. So she did an amazing job on this first session, bless her. And yeah, she progressed really well, but we may have a dog where we wouldn't even get to this stage on the first session, which is absolutely fine.
And how long is the session? Are we talking like an hour?
No, shorter actually. So our hydrotherapy treatments tend to be 25 minutes, 30 minutes, and especially in the water treadmill, what we're looking at is that quite often you may see that, like when a dog's walking in the treadmill, if they're walking for 2, 3, 4 minutes at a time, it doesn't sound like a lot, but especially when we're doing a lot of correctional kind of supports where we're trying to promote a good quality movement, and we could have a dog that's been walking abnormally for multiple months, multiple years, exactly. So we're then asking them to go from they're walking abnormally, essentially, to us trying to correct that. So us supporting them in different ways so that they do want to extend it a little bit more, or they do want to bend their leg a little bit more. Plus through the resistance of water. So it's going to be really tiring. It's going to be a bit like if I asked you to do 100 push-ups for me straight away. If you're anything like me, after about 2, I'd start struggling.
Isn't it? Building up.
Exactly. Whereas if I asked you to do 50 push-ups, but I want you to do them in 5 sets of 10, you're going to find that a lot more kind of easy to accomplish. So the idea with the water treadmill, especially what we find, is if we do shorter sessions of good quality movement where we are correcting their movement against that resistance of water, they're going to fatigue really quickly. And as soon as they fatigue, they're going to start switching back to their old compensatory patterns. And that's not what we want to be promoting, where we're just going to be strengthening an incorrect gait, etc. So I wouldn't be surprised if your first session is going to only include 30 seconds worth of good quality movement, and that would be fantastic. That would be a brilliant session. And then they could progress to 45 seconds, minute, etc. But it's very easy to kind of think that they're not doing a lot, but if you just break it down and just think, okay, working against the resistance of water at quite a decent water height with correctional changes, it's hard work.
None of these things are going to be overnight fixes, are they? It's all
exactly, for sure. And the longer we've got this disuse atrophy, or the longer that we have this abnormality of gait, then the longer it's going to take. And again, it's about the best quality movement for your individual dog. We're not expecting a 15-year-old collie to be walking absolutely perfectly with the supports that we do. It's an unrealistic aim. But what we're trying to do is promote the best quality movement for that individual dog, and a movement pattern that's as pain-free as possible with the support of the water. It's really good stuff, really. Right, so moving on to a bit of swimming now. So this is Moss. She's a beautiful 5-year-old Springer Spaniel, and she come to us with her condition of patellar luxation of the right hind in particular. So patellar luxation is essentially the kneecap luxating, so moving out of the groove and then going back in. So she started in the treadmill actually, but we found that she was luxating quite frequently. And then when she started swimming, we didn't have this luxation. So this was fantastic, and swimming was a better form of therapy for her at that particular time. So this is what the video that I'm going to show you now. This is essentially the sort of swim that we would love to achieve with all of our dogs, with your dog and with all of the patients that come here. But she's very fit and she's young. And what we're looking at, so just before we play the video, is that, can you see my cursor on the screen? Perfect. So we're looking at a multitude of different things, and this is why underwater footage is so fantastic, because we can break down everything and do slow motion, which is what this video is. And what we're looking for is what their body position is like in the water, and in particular their spinal position here, because what we don't want to be seeing is an exaggerated spinal position, for example. So a lordotic posture tends to be quite common in the swimming pool, and that's essentially where the spine's extending, and you'll see that by the spine almost resembling like a smiley face, and that's just putting quite a lot of pressure, especially through their mid-thoracic area, and tends to be because they lack abdominal strength as well. So we want to have a nice straight body position, and a body position that's relatively high in the water, because if we have got a lower body position, it means they're going to have to extend their neck more to keep their head above water. So then you're also putting additional pressure through the neck. So Body and spinal position, important. And obviously, if it's not the correct position, we've got multiple holds that we can do to address this. We've also got how the dog's moving, so how fluid they look, how evenly they're using their limbs. So, for example, Moss may use her right hind a bit less because we know that she's got an underlying pathology there. And then the next thing is working out their joint ranges as well, which is quite fun to break down into slow motion as well. So I'll, without further ado, play said video.
We love a slow-mo video.
Yeah, slow motion's awesome.
Look at her go.
Yeah. She's a beautiful lady. Yeah, and it really just makes you happy seeing this video, really, because you can see her just so effectively using her body. It's so fluid and smooth.
And it looks effortless almost.
Yeah, exactly. The fluidity is just absolutely fantastic. And then if we just break it down even further, so if we start with her stifle or her knee, if I can find my mouse again. We can see, so if we're looking at this stifle joint in particular, you can see that she's flexing there, really lovely, and then she gets a really good extension as well. So you can see that she's using her stifle to a really good full range. Yeah, and you can see the power is absolutely incredible as well. And then if we just go to the front of the screen again as well, you can see that her elbow here, you can see that it achieves a really acute angle. So when we're talking about joint ranges, it sounds quite complicated, but if we just break it down initially to sagittal plane of movement, so straight line, we're looking at extension and flexion. And flexion is how the dog bends their joint, and then extension is how they straighten it. And with the elbow, when swimming, they should be able to bend their joint to a very acute angle like here. And you can see that she's her carpus is almost touching the water line because she's got such good elbow range there. So you can see that she's really bending her elbow and she's really extending it as well. So just a really lovely swimmer.
Just in case anyone not aware, the carpus is where the wrist is, where, like you say, she's touching the water there. And the way I remember flexion and extension is flexion is kind of bringing it towards yourself, isn't it? And extension is taking away from yourself.
Exactly.
So the joints are working amazingly there, especially in the front legs.
Yeah, exactly. So that's her from a kind of underwater perspective. But it's also important to remember that, again, she's not always going to just be essentially free swimming. We're also going to be, in particular, especially when she first starts, having a feel of her stifles, because we need to be ensuring that she's not actively luxating, because we do not want to be promoting that. And if she was actively luxating, she'd have to go back to the vets. Or we could just change treatment plans first, so if she's luxating when swimming, she may not be in the water treadmill, or she may not be when she's standing. But quite interestingly, Moss was fantastic when swimming, as in very minimal luxations. But when she was standing and doing weight shifts where she was moving her body either forward and back or side to side, that's when it was more likely to luxate. Whereas now she's had quite a few sessions with us and she doesn't luxate so much now within the treatment. When she's standing, for example, there's just a little bit of laxity within the group itself. So yeah, she's doing really well and she's progressing really nicely.
So the purpose for her was mainly to supportive therapy around the stifles then?
Yeah, so it was just about trying to find an exercise for her where she was less likely to be luxating, and we got her into the treadmill first just because it's in the treadmill it's a really good the thing with patellar luxation is that when a vet is able to assess it, or even a physio, quite often they need to do it statically, so they need to be having the dog in a stand and they can be manipulating the joint and the stifle to be seeing how likely the patella is going to be luxating. We have a really fantastic perspective because we can feel them whilst they're walking, whilst they're swimming. So it means that sometimes we pick up even more of a luxation or even less of a luxation in comparison to what statically vets or physios are seeing in clinic. So the treadmill would be quite good if she wasn't luxating, because we want to be or if we could give her enough support where we wasn't feeling that luxation. But unfortunately she was. So we went to the pool, and the pool's going to be really good because you can see how well she achieves good flexion and extension. And you can see that she's really got some power behind those hindquarters as well. So in particular, her quadriceps, which are going to be a really important mechanism in trying to keep her patella in line. We're trying to strengthen those as well as the whole body as well, because again, as soon as you have a weakness in one area, you're going to get compensatory patterns. So we want the whole dog to be strengthening as well, which is what swimming achieves. So moving on, this is Elka, and she's an absolutely fabulous German Shepherd who's 3 years old. She actually came to us as an inpatient during the first lockdown, and she had a very peculiar diagnosis where she had kind of fleeting symptoms of just lethargy, etc., over the course of a couple of months. And then when she just seemed even less like herself, she went to a specialist and they found that she had an infection in her kidney. So they checked all of her organs, etc., and kind of did that surgery. And then as she was recovering, she actually became paraplegic, which means that she was unable to use her hind limbs. She was paralyzed with her hind limbs. So they had to do subsequent investigations, which revealed a grass seed in the left side of her lumbar area in the spine. And this grass seed, because obviously it had been there for a couple of months by the time it was discovered, it led to paravertebral inflammation, so inflammation along the vertebrae. It resulted in spondylitis, which is inflammation of the vertebra, and meningitis, which is inflammation of the membrane that covers the spine or also the brain. So this little grass seed, did quite a lot of damage, bless her. Yeah, for sure. So she came as an inpatient because obviously she was paraplegic, so unable to use her hind limbs. And because of all of this inflammation and infection, she actually had to have a spinal surgery, which is called a mini hemilaminectomy, and that's a decompression surgery, just to try and just
ease off
the inflammation. Exactly. She did recover really well, actually, and she was an inpatient with us. So she had 24/7 rehab and physiotherapy and hydrotherapy, and now she lives a very fulfilled life with her parents again. So she was a fun dog to be working with. But the reason that I've brought her up is because, so in comparison to Moss, you'll see that actually we see a much different movement pattern with Elka. Yeah, so you can see forelimbs are moving quite nicely, but her hind limbs are very reduced. So in particular, so they just hold themselves in flexion. So they just keep quite in a bend quite a lot, and that's through her whole limb. So that's her hip, her stifle, her hock. She just doesn't have much range there in comparison to what we know dogs without pathologies can kind of achieve. So this is when hydrotherapy really comes into its own, because we can then, as hydrotherapists, use our supports to try and improve their movement when they're in the water. So this is just a little example of what we can do to help increase this range. And this is basically us just holding or providing input to their paws, which you can see here, that we're just kind of holding their paws there. And this input is essentially a bit like, so we're trying to increase the amount of proprioceptive awareness. So the amount of sensory input, essentially. So if you can imagine as an owner, so say like you're walking around barefoot, as soon as you put socks on, you're much more aware where your feet and where your you haven't got paws, it's feet. So you know where those are. What we're trying to do is we're not forcing her to increase her range. We're just adding a sensory input, just to try and increase this range. And you can see, and if we really broke it down, you can see that we actually achieve that through her distal limb, so her lower limb through stifle and hock. Her hip range is still quite limited. So we found that treadmill was better for her to actually get that increased hip extension.
Okay, because she was getting the stimulation all the time then.
Yeah, exactly.
What was her mobility like outside of the water at this point? Was she dragging limbs?
Yeah, and at this point she was still using a hindquarter harness to provide a little bit of pelvic support for her. And she was able to initiate stepping, and she was able so she was able to initiate stepping, but there were a lot shorter strides, and she was quite weak here as well. She did improve. especially when we went back to treadmill as well. So just a little kind of disclaimer about this sort of input in particular is that it's really important to know our goals for your individual dog. So if, for example, we feel like your dog's range is limited by pain as opposed to it being a functional reason or a neurological reason, we're not going to be aiming to increase range in this way. We want them to be swimming within a comfortable range, which again you'll see in slides in the which we're going to be seeing afterwards. So it is just important to think that, you know, just because your dog isn't getting this input, there's probably a valid reason for it. So yeah, Elka had frequent pain assessments to ensure that she was comfortable, and it was a functional reason that she wasn't achieving good quality movement, for sure.
No, it's a really good point, actually, because people think, why is my dog not getting that? But it's exactly why you said, it's
exactly.
for different reasons.
So moving on to Max, another lovely dog that we have. So he's an 11-year-old border collie, and he's had a multitude of orthopedic conditions. So he's had a left total hip replacement in 2010. 2014, he had a right total hip replacement, which unfortunately failed. So it means that they had to do a femoral head osteotomy instead. So they had to cut off the ball part of the hip replacement.
Yeah, so it's kind of classified as a salvage procedure, that, isn't
exactly.
it? So the joint isn't fully functional anymore, but it's as pain-free as it can be.
Yeah, definitely. So he also has bilateral elbow arthritis, and he did have a right femoral fracture in about 2019 as well, and suspected left cruciate disease. So he's multi-joints affected here.
Yeah.
But he very much loves his starfish, so you can see that he's loving life there. So this is just an idea to see how hydrotherapy can affect their movement as well. So this is Max. So this is actually Max when he's not feeling his best. So this is him when he is involved in kind of an arthritic flare. So you can see that he looks quite uncomfortable across all of his limbs. He's got a left forehead nod in particular. Yeah, exactly. So you can see that his forelimbs in particular are really struggling on this particular day. And this is during an arthritic flare. So again, this is how our treatment's going to change, because normally we'd have an amount of active treatment that we'd be doing with Max. But if he presents differently, such as increased lameness, we're going to be adjusting our treatment. So that's why it's important as well as an owner. If you do see a change with your dog, either in terms of mobility or you're changing medication, lifestyle, etc. If you feel like there's a big difference, it's always worth giving your hydrotherapist a call before arriving for treatment, because we need to make a decision as to whether we feel hydrotherapy is actually going to help in that instance, or whether we feel that you're going to be better resting, for example, instead. We know Max does really well with hydrotherapy, even when he's in an arthritic flare, and we know that it benefits him. So again, it's all about individual patient needs.
Yes, yeah.
So this is him swimming.
Is this on the same day when he was having the flare?
Same day, yeah, exactly. And again, you can see the good thing about when he's swimming is it looks a lot more fluid compared to when he's walking. So you can see that he already looks comfortable, and that's likely due to the buoyancy effects, being non-weight bearing, not having painful concussive forces going through. But you can see, if you're being particularly picky, that his elbow range is reduced in the water. You can see that he's only kind of achieving a 90-degree angle at best.
Right, okay.
So this is when we're really going to be kind of getting into the particulars, really, and this is what your hydrotherapist is going to be looking at. We're looking at body position, spinal position, head position. Then we're looking at how fluid the dog looks when they're swimming, if they look comfortable when they're swimming, which is really important. And once we've ticked all of those boxes, we can then be getting down into the nitty gritty about different joint ranges, etc. But yeah, so again, do you remember with Moss that she was able to bend her elbow really high up to the point where her wrist was touching the water? Exactly. The difference you can just see. And again, it doesn't mean that hydrotherapy is not as beneficial for him. It just means he's swimming within a comfortable range, which is absolutely fine. But what I wouldn't want to do on this occasion is start to be trying to increase his range. So I wouldn't want to be, having a feel of his elbows and trying to increase flexion, for example, because I know I know what the cause is, and it's not due to a mechanical lameness. Essentially, it's because he's having a painful flare.
Yeah, you can really see the difference in the back legs there as well, can't you? The right one is very shortened and
Definitely.
Spend that as
Yeah,
much.
and you see a little bit of rotation there as well as he does that power stride as well. So what would be
like he wants to get it over with quickly, and then
exactly. So you see there just a little bit of rotation going on.
Yeah.
So what we'd want to be doing is providing him with a little bit of stifle support or hip support, because likely the rotation's coming from the hip instead. So what we want to be doing is providing him with a little bit of support on the sides of him, so it would be his lateral sides, and just see whether we can make him feel a bit more comfortable when he's swimming. But again, that particular support wouldn't be to increase his range there. It'd be to try and reduce the amount of rotation that we have.
Yeah.
So this is him after the session. And you can see that we've still got a lameness there, but he's holding his head a lot higher. He's happier.
Even his tail looks happier.
Yeah, exactly. So we're not looking to make drastic changes sometimes. Sometimes if we can improve a dog's quality of life on that particular day and just give them that general feeling of well-being, then it's definitely a worthwhile session. So just because we have hydrotherapy so beneficial for dogs that, you know, aren't presenting very lame or painful, because we can be pushing them like what we do with Moss, but it's also beneficial for dogs when they are experiencing pain. And so it's important just to be managing them, you know, as their individuals, really.
Yeah, definitely.
This is Ted. Yeah, you can tell he's a bit of a cheeky chappy, can't you? So this is Ted, and he's a 1-year-old Labrador, and he has bilateral elbow dysplasia. So he has coronoid process disease. So he had an arthroscopy, which is basically a camera having a look on the inside of the joint, and they're going to be removing any loose fragments, for example. So yeah, exactly. And just get an idea of the actual diagnosis as well, because we know elbow dysplasia is a very much an umbrella term for it's a very complex joint and a very complex condition. Exactly. Again, another lecture for another day. But yeah, he's we've got this bilateral elbow dysplasia that we're trying to help with. So Ted is a little bit of a superstar in here as well. So you can see, even though we've got elbow dysplasia, and we know that with elbow dysplasia, elbow flexion can be particularly painful, but you can see in the hydro pool, we're achieving really lovely elbow flexion and extension. And you can see that he just looks very fluid. It looks very effortless. He's very comfortable in there. He's achieving nice range from his hind limbs as well.
Yeah, looks good.
Yeah. And this is, I'll mention now because he's in a buoyancy jacket now. And again, we work with both buoyancy jackets and harnesses. You can see underneath he's actually got a harness on, which is what we're going to switch over to on the next one. So it's important to know which piece of equipment is going to be better for each individual dog. We tend to find with our arthritic patients, they tend to need buoyancy jackets because increased buoyancy, better position on the water, and it just makes it a lot easier for them to be swimming essentially. Whereas but then it depends on the dog, because sometimes the fit of a jacket or a harness is going to so there's a lot of different factors as to whether you're going to use one or the other or both. Yeah, exactly. But you can see here that we're achieving fantastic range even in this jacket, you know. So it's a case of, you know, case by case by each individual dog.
I may just bring up this question from earlier actually at this point, from Susie, just saying, from Roxy right at the beginning, the boxer, to say she was obviously in the treadmill, not in the pool, but may I ask why Roxy isn't wearing a jacket?
Yeah, it's a very good question, actually. It's because she's very nervous of harnesses and jackets, anything going over her. And on her first session, which was actually a pool-based session initially, as soon as we put a hydrotherapy jacket on her, you could see her body tense up. And it was just because she's not used to wearing it. And the same was for even using different types. We've got different types of harnesses here as well. And you could just see as soon as she had a harness on, she wasn't comfortable in it. Especially and especially it being a brand new process for her. She didn't really know us. She didn't know the environment that she was in. So we didn't want to add another variable essentially that we know she's already uncomfortable with.
Yeah.
So Roxy actually had a hydrotherapy session with us today, and she for the first time wore her harness, which was a really big achievement, for her and for the owners. They'd been working on it at home, but because we're very lucky where we have quite a few members of staff, we're able to provide the support and the necessary kind of safety measures in place to allow for good movement essentially without using that piece of equipment. Obviously ideally your dog's going to be either in a harness or in a jacket or some means of way of supporting them when needed, but again behavior is just as important. Exactly, and behavior plays just an important role of our decision in that, as does their condition, etc. So so she was in her first little harness for the first time, so we got lots of pictures actually.
Big day for her.
It was a very big day, bless her. So this is Ted, same dog, but this is him in a harness, same session, just to make you aware. And again, you can see that he achieves really lovely joint ranges still. And we found that we do quite a lot of his work in harness now actually, because he's maintains a really lovely body position still, so we're absolutely fine with that, but he actually slightly slows him down, which means that we get better quality movement, because he sometimes does like a double kick with one hind limb in particular, whereas in the jacket, is it going to be there? This little left hind likes to do a double kick every now and then. So it's about just reviewing. Again, you can review your underwater footage film with your patients and kind of just determine. And if you're unsure which equipment's going to be better for them, then try both and see what you think's going to make a difference. And again, you're looking at behaviourally and physically as well.
And that also just answers the question up here as well, actually. Somebody should try and find it now. Basically, the question was, when do you choose the treadmill instead of the pool? And like you just said, if you've got the option for both, depending on the dog, depending on the condition, you might want to try both.
Yeah, exactly. And it comes down to as well the experience of the hydrotherapist as well, and it also comes down to exactly what conditions your dog has as well, and depends on our overall goals as well. Again, this could be a whole new lecture in itself, which would be fantastic. But you've got to be thinking what your main aims of your hydrotherapy treatment are, because walking in the treadmill, for example, we're looking at predominantly when we're getting them walking on the belt, good quality movement when walking against resistance of water. And the reason that water is so important during this aspect is that if you have a good high amount of support from the water, i.e. water kind of above mid-femur, which is the top bone on the hind limb of the dog, it means that we're applying maximal resistance through the muscles, because it's really deep water. It's a bit like if you yourself goes out into the beach or in the swimming pool, the deeper you go, the more resistance you can feel. So that's really good from a muscle activation perspective, but it also means it's good from a buoyancy level, because it means that we're increasing the amount of support that they have. I've gone off tangent, so we're talking about pool and treadmill, etc.
No, that's fine.
It very much depends on our aims, because if we're looking at strengthening them during walking, then treadmill potentially is going to be better for them. The important thing to know about swimming is that we do tend to increase joint ranges, especially in like the elbow, the distal limbs. So we're looking at distal joints, elbow, carpus, which is your wrist, stifles, which are your knees, and your hock, which would be your ankle. So are we looking at, is our aim to increase joint range, for example, or is our aim about power, for example? And if it's power, is it forelimbs or hind limbs? Because on land, most of your power and propulsion is coming from your hind limbs, whereas when you're swimming, it actually reverses a little bit. So your forelimbs are actually putting a lot more power in. So there's so many different variables and reasons. And that's just talking about dogs biomechanically. And then you've got to think about your condition as well. So there's so many different reasons.
But also, like we said at the beginning, not every hydrotherapy centre is going to have both, and that doesn't mean that it's bad. It's just you use what you're familiar with and what suits you, don't you?
Yeah, definitely.
Who have we got?
this is Ted again, because he's such an amazing dog. So you've seen Ted in a harness, in a jacket. Now this is Ted, and we've been focusing on kind of this flexion extension, this straight line of movement, etc., which is really important, and it's kind of like the main movement pattern that we're looking to help with. But it's also important to think about the dogs that need to be increasing their dynamic stability, so the way that they're able to do twisting and turning as well. Because especially for Ted, he's a 1-year-old Labrador, and it's really fantastic that his mum has had such a proactive approach in managing his arthritis. So where he's very asymptomatic at the moment, he's not showing signs of discomfort or pain and many gait changes either. So what we want to be doing is seeing these dogs when they're younger or when they're displaying less arthritic changes, because we can really be having a proactive effect on them. So with Ted as well, so again, mum's very good with home management, so his exercise is very well managed, etc. But we still need Ted to have a good quality of life, and we still need Ted to be able to have fun. So be involved in dog play, for example. We don't want him to be chasing ball throwers or anything like that, but we certainly want him to be able to make those dynamic changes by doing those twists and turns. So if he did randomly chase a squirrel, at least we've built up the muscle dynamically to just, so it's not just about strengthening his extensor and flexor muscles, so the ones that are getting him to move up and down. It's also about helping him build up the muscles that are going to be used in ab or adducting the limb, so moving from side to side.
I mean, this is the ideal time to start treatment with him, isn't it? It's
not exactly.
It is now.
Yeah, for sure. And again, hydrotherapy is so effective for dogs with with dogs where they're very asymptomatic, because we can be pushing them in a different way. But it's also very good for pain management, and it's very good for your older patient as well. So but yeah, the good thing to see on this is Ted's really demonstrating quite nicely the different ranges that the shoulder and the hip in particular can do. So I'll just play it one more time so you can see. But you can see, instead of him completely extending and flexing all the time, we're getting those turning motions. And the best way to build up these turning motions is in a non-weight bearing, non-concussive environment. So that's why we do twists and turns, so like circles, figure of eights, zigzags. Sometimes they're incorporated into the routine. But again, that's very specific based on the individual dog. So if the dog had hip dysplasia, for example, we know that the hip, with the hip, we've got, it's multi-directional. So we know that it's a ball and socket joint. So as long as we haven't got pain being the limiting factor, and if it's more of a maintenance strengthening program, then we really want to be strengthening around the multi-directional ball set. Exactly. Quite. Whereas if you have a dog with elbow dysplasia, for example, where they have got so Max, for example, who we saw, the collie, I wouldn't be wanting to do lots of tight twists and turns with him when I know he's already struggling in a straight sagittal plane of movement, so it's, again, patient specific. Okay. This is a very lovely Monty, who's a border collie. He's 15 years old, and he has hip dysplasia and arthritis. And this is just a little kind of tangent just to say hydrotherapy isn't always about the active work. Simply being weightless has a massive therapeutic effect on a patient, and especially our geriatric arthritic dogs. So just floating a dog can promote muscle relaxation and alleviates concussion through forces through the joint. So this is Monty just enjoying a little float. And we do have some dogs where, especially if they're in a flare, or we do have some of our older patients where they do come to us for a float session, and that's going to involve floating. It's going to involve potentially some standing work. But it's important to remember that it's not always about the active movement, and it is really beneficial sometimes just to be weightless and being with a professional when doing so that they can be monitoring them, because obviously they've still got the pressure of the water exerted on them. So we need to be monitoring, i.e. if they had a heart condition, for example. So there's still really, it's not as simple as just floating a dog. So we need to be, thinking about it. But I
think some people they do get quite disappointed, don't they, when they come for the first hydrotherapy session and they think, well, what's just been done there? Nothing.
Exactly.
They don't really see much, but then like explained all those benefits that you get from all sorts of different movements, whether they're doing it or whether you're doing it for them. They still see the benefits.
Exactly. Or not moving at all and just having a float. Depends. Okay. So this is changing equipment now. So this is going to the water treadmill. And again, another collie. So this is Inky, and he's 14 years and 8 months old. And he's got lumbosacral disease and spondylosis. So this is the first part of the video is going to show you when we're not really supporting him as much as what we could be. And then towards the end of the video, you'll see what happens when we do support him.
Yeah, it's a really good one, this.
Yeah. So as you can see, he's really struggling to bring himself through the water, particularly with these hind limbs. And you'll see soon that when he's picking his leg up, that he starts to knuckle his paws. So you see a little bit here, a little bit here when it's coming through. Knuckle here. And he's also kind of hyperextending. So we're getting excessive joint range there. So it's really important that we're not just looking at them from a top view or from a certain angle. We need to be looking at them from every single angle, and indeed slow motion as well, which is going to help. But you can see as soon as Sarah goes hands-on and does some hock support, you can see how much more fluid he becomes. You can see how much more confident he is using his hind limbs. We get a much better bend of flexion of these limbs. We get no more of this knuckling, which is where his top part of his paw is knuckling over. And he just looks much more comfortable.
Definitely.
So it's important to note here as well that Sarah isn't trying to, again, she's not forcing that limb into a better quality movement. She's simply providing support in the correct areas to make him feel more comfortable, and he feels supported enough so that he's able to make those changes himself, essentially.
Makes a huge difference, doesn't it? Just
it does.
Having a professional knowing what they're doing and putting their hands in the right place.
Exactly. And and looking at the whole dog, that's really important in the treadmill, because again, it's so easy just to be looking from one angle, and this is why we do video, because what we're seeing from side view is completely different to what we're seeing from front or back, etc. So really important to get in the whole dog and their whole movement as well.
We've got a question here from Carolina about if the aim of hydrotherapy is to strengthen hip joint muscles and increase the range of movement in the hind legs, is there a way to measure this somehow apart from comparing videos? Is there a way to measure pain level and muscle mass on the hind legs as well? I know there are pain medication trials. However, are there ways to compare before and after without the owner bias? That's quite a good question, because
that's a very good question.
A lot of parts to that.
There are, very much so. So if we break it down part by part, and if I miss anything, if you wouldn't mind reminding me, that would be great. So if we're talking about from the pain element, there are some really good objective measures that are in place now. So you can actually be doing some like pain scoring, which is when kind of like pain management specialists really come into their own, really, or even your general practice if they have a keen interest in it as well. There are some pain scores that you can be doing, which are quite based on subjective information from the owner, but as owners, you know your dog's best, so quite often we need to be knowing how you feel your dog is in terms of pain. So there are quite a few different pain scoring charts that you can be using. So you've got Coast, Vetmetrica, Load, so there are quite a few different ones. Also, I believe CAM has a really good resources on their website that includes objective markers that you can be using to download as well. So it's about, when you're looking at pain, it's about pain's going to present differently between your own dogs, and it's about working out what factors you're noticing where you believe your dog's uncomfortable, because it's not just about lameness, it's about, are they panting more, are they restless during the night, are they lying down halfway through a walk. So it's working out your own objective markers that you know aren't going to have a subjective influence, essentially. It's about kind of knowing, okay, I know when my dog is uncomfortable, they're going to be panting more, and then just making a note of it. And you know, you can be as in depth with your note taking as you can imagine me with my own dog. When he's having an arthritic flare, I'm very over the top with my objective marker.
Have 4 or 5 things that you have that you assess on a day-to-day basis, isn't it?
Definitely.
And they can be anything.
So Max has like his tail carriage as a husky should be nice and it's like a Spitz tail, so curled over. That tends to drop when he's painful. He tends to be quite restless and panting, and sometimes as well, like, it is just a case of, it sounds very subjective, but sometimes they just do look like more tense in their face, for example,
Yes.
or look sad, you know, like they're just not their normal cheeky self. So it's just about, try and, even though you're subjectively going to be kind of looking at it, you can use objective measures really well, because you know your dog best. So pain, that's that side of things. As a hydrotherapist, there's many things that we can be looking at as well. So we can kind of tell if a dog's painful on how much they're using their legs, and again, looking at the behavioral side of things and the way that they're moving as well, what their standing tolerance is like. So as a hydrotherapist, we're going to be kind of giving you information on if we think your dog's painful and what level of comfortable they are for your own individual dog, essentially, because it can be a case of, oh, I think Inky's having a really good day for him, which is good for him, but not necessarily means pain-free. Or exactly. Quite. So
and there are some really fancy things you can do now where there's these special mats that kind of give you percentage-wise of how much weight is through this limb, that limb, and so you can then see if your dog is improving in the way that they're shifting their weight or standing in their gaits and that kind of thing. So loads of gait analysis, fancy technological stuff that I would not even try to explain to people, but there are other things that you can do. Yeah, absolutely.
Definitely. They even have like walkways, gait walkways and things. So it's all very fancy these days, isn't it, for really objective measuring? Indeed. So that's from the pain side of thing. Was the other in relation to joint ranges?
I think it was joint range and then muscle. Is there a way to measure pain level and muscle mass in the hind legs?
Yeah. And again, that's something that your physiotherapist can probably really help you with, because that's their area of expertise, essentially. So they're really good with musculoskeletal problems and neurological conditions as well. And physiotherapists can do things such as taking muscle mass measurements. But even then, there's quite a technical process behind it, because you need to be using a particular type of measuring tape where tension isn't going to be causing a difference. And you've got to be deciding what scale you're going to be using, i.e. centimeters, inches, etc. Physiotherapists definitely have their own way of kind of assessing muscle mass, and they can kind of tell you which muscles are underdeveloped versus overdeveloped, and give you some advice on there. So I'd probably just seek professionals' advice, really. So again, physiotherapists, hydrotherapists, they're going to be able to give you some tips on objective measuring, measuring muscle mass, measuring pain, measuring everything. So.
And I think if you again, it always comes back to working as a team, doesn't it? And if you've got your dog being seen on a regular basis, I know some of the ones that I see regularly, I know for like 2 weeks ago, I'll feel it again, and I'll appreciate a difference because I'm not seeing them and feeling them every day. I think I have a better perspective on certain things.
Definitely.
When you're with them every day, you can convince yourself one way or another, can't you?
Yeah, 100% you can. And just having someone that even sees them on a weekly, fortnightly basis. Yeah. And also you're going to pick up on subtle changes of deterioration as well as improvement. So for sure. I hope that answered the question.
I think it did. I hope so.
Perfect. And as well, so just saying with Inky as well that we've got some postural things that we should be looking out for as well. So it's not just the dynamic walking element, we're also looking at standing. So you can see here, Inky's quite wide with his hind limbs. He's right hind's slightly more protracted forwards. So it's just faced slightly forwards. In the next one, you can see both limbs are protracted forwards in comparison to where they would be, and his hind limbs are quite narrow. Forelimbs are quite narrow, sorry. So it's about looking at their posture and also helping to correct that as well. So you can see here, Sarah's just doing some standing exercises and standing work just to try and get him standing a bit more neutral. So there's a lot that goes into a hydrotherapy session. So this is Truffle, Field Spaniel, 13 years old, and he has elbow dysplasia and arthritis. And again, it's just giving you an idea of the sort of things that we're looking for. So you can see again, he's got quite limited joint range on land, and you can see that he has got, and this is in this is normal speed now. So this is how fast he's going. And you can see that he has got that reduced elbow range and reduced hind limb movement as well. And you can see, so all I'm doing as well is I'm just providing him with a bit of chest support there, just because he is slightly low in the water. And again, we don't want to be putting excess pressure through that neck or making him extend his neck to keep his head above water. So there's loads of different hydrotherapy holds and techniques we should be using to ensure the best quality movement for the dog.
Sure. Yeah. But he looks comfortable, doesn't he? But you can really appreciate the change in the range.
So he's got a fluidity in the way that he swims, but you can see that it's very much within comfortable range.
Yeah.
And again, so this is me just giving him a bit of elbow support. And again, this isn't to increase range here. This is so that I can have a better understanding on how his elbow is moving, because we don't always have underwater film. We need to be using our hands as well. And it also allows us to feel if there's any crepitus, so any noise within the joint. Is there any clicking, clunking, creaking, any noises, and any noises that we wouldn't expect to be there, we can then report as well.
Yeah, absolutely.
Oops. Another treadmill video. So this is Ramsey. He's a 10-year-old beagle, and he has a variety of conditions. He's got left hind hip dysplasia, right fore elbow arthritis, and lumbar intervertebral disc disease as well.
Okay.
So again, this is a different type of hold that we're doing. So I'm just giving a little bit of proprioceptive input, so that sensory awareness on his paws again. And again, this kind of demonstrates that we're not trying to achieve perfection all the time. We're just trying to achieve the best quality movement for the individual dog. So we can still see that we've got a little bit of reduced range for his forelimbs. We're just getting his motivation right here, actually, because you can see that he's extending his neck to get the cheese a bit too much. So on his next video, he does tuck it up. So in future sessions, we did reduce the cheese close to his head, because beagles are like Labradors for food. They absolutely love it.
They'll do anything.
Exactly. And again, what's just important to note here is that I'm not forcing him to increase his range or forcing him to bring his leg forwards more. I'm just providing him with input, which just makes him, it's a bit like if they're walking through the lower water, just gets them to pick up their legs a bit more. And there are so many different supports that we have, So there's lots of different supports we have in the treadmill. This is a familiarization session where mum is actually in the treadmill, lying down to try and get the young man in. So, we need to be creative as hydrotherapists to try and get the dog as comfortable as possible. And you can see, and you'll see in the previous videos, there's only one person quite often with these in the pool, for example, but quite often we have two hydrotherapists in. Exactly. And especially in the treadmill, this is apparent, because in order for us to achieve the best quality movement, quite often they need various different supports. And the best way to support them is with our hands, because we can feel what's going on, and we can do so many different changes and different ways of adjusting certain holds. So you can see here, we've actually got 5. I counted 4 on the first count, but there's actually 5 hydrotherapists in here. There's a little face there and a dog there.
I'm sure there's a joke in there somewhere, isn't there?
Indeed. Exactly. For sure. So yeah, it's all about using, the hydrotherapy equipment and using our therapeutic holds essentially to the best of our ability to make it as effortless and as pain-free as possible. So again, loads of different holds that we have. So yeah, I think that's there we go.
I've got just a question here about the beagle. I can't remember his name now. Sorry. Ramsey. Because this, I think, is relevant to there, because he's got the back issues as well, hasn't he?
Yes.
And Lynn's written here, I've been told that hydro on a treadmill is contraindicated with lower back issues.
As in hydrotherapy in general, or just pool or treadmill, or is it just hydrotherapy in general? On the treadmill.
On the treadmill.
Okay.
What's your opinion?
We actually find it quite often the other way round, depending on the dog. So with a spinal condition, or even so if it's in the lower back, so say we've got lumbar IVDD, intervertebral disc disease, which is what Ramsey has. Actually, being in the treadmill means that we're able to control their movement a lot more. And we know that walking, in comparison to swimming, for example, is within a much more controlled range. So we know that swimming increases range, which is really good for some dogs. But for a dog where we kind of want to be keeping movement a bit more controlled, like with our spinal dog, and where we want to be promoting a much more neutral spinal position, we actually can achieve that sometimes a lot easier in the treadmill, again depending on the dog and depending on what their movement quality is like. And when they have got neurological conditions such as IVDD, what you tend to find is that they have neurological deficits. So it means that their reflexes are going to be delayed, and the signals getting from the brain to the hind limbs in order for them to move are delayed or absent in some cases. So actually using the water treadmill can be quite beneficial beneficial because we're increasing the sensory awareness through standing in the water, and we can also do a really important part of their rehabilitation, which is gait re-education. So if the dog is kind of knuckling quite a lot, for example, or they're quite ataxic, so quite uncoordinated with their movement, we really want to be promoting a good quality movement and kind of really helping with their muscle memory, etc., and kind of doing that little and often walking to just do just get them a bit more, try and get the right movement easier for them, essentially. So so very much depends on the condition. And also a really important part of that question as well is if it's been stabilized or surgically corrected, for example, because if you're dealing with a conservatively managed neurological dog, then again they could still potentially go in the treadmill, but that's more of a caution in comparison to if they've already had this stabilization surgery. Exactly. So it's about knowing exactly how many discs are affected, for example, if we've also got other spinal, like spondylosis, for example. So it's about knowing exactly the individual dog, essentially. But actually, gait re-education on our neurological dogs is really an important part of their rehabilitation. And in the water treadmill, that's going to be your best place to achieve it sometimes.
Yeah, that makes perfect sense, doesn't it? I mean, it could just be, Lynn, that it's not appropriate for your dog with this kind of issues for other reasons, but
and again, it's also thinking about like dog size as well, because if you've got an underwater treadmill and you've got a Great Dane that's got lumbar IVDD, where it's going to be a lot harder to support them, and you're not going to be able to guarantee spinal neutral position, and you're not going to be able to have 5 people like in this picture kind of providing with all that support, etc., then potentially the hydrotherapy kind of isn't going to be beneficial, because we can't achieve that supportive walking that we need. So if we can't achieve good quality movement in the water treadmill, especially with our neurological dogs, then it shouldn't be done. For sure. So we need to ensure that it's done correctly.
It's so individual, isn't it?
Very much so.
Well, I think I'm going to try and bring it to an end. I think there's Pam's comment here. I don't know if it's someone that comes to see you, Rebecca, but she's written that you're so knowledgeable, Rebecca, and so interesting to listen to you. Thank you for sharing it with everyone. I think everyone would probably share that feeling. So thank you so much for your time and your presentation as well, because Rebecca was thrown into this at the last minute, but she's done fantastically. So thank you so much for coming on and talking to us. I'm just going to take this presentation off now so everyone can see it properly.
I'll just
and if you do have any questions still, and there are a few that I haven't got round to, I will try and answer them later on. But if anything comes up, please do give us a shout, and I can ask Rebecca and hopefully get you an answer. And we'll have her back to share more information, hopefully.
Awesome. Please do. Fantastic.
So have a lovely evening, everyone, and please do jump on board for the big walk. It starts tomorrow. Get involved tonight if you can, or first thing tomorrow, and we'll get you onto that Facebook page where you're going to get all this extra information, all these live sessions, all these live Q&A sessions with the specialists. So please do get involved, and we'll see you soon for another live. Take care, everyone. Bye.
Thank you.